Hello, precious people. My name is Dr. Iphie Blossom Oma Kalu, simply known as Dr. Iphie. You're welcome to my YouTube channel, The Platform with Dr. Iphie. This is my maiden edition, and I'm going to be running a series throughout the month of April 2022. I've entitled it, Take Personal Responsibility. Take Personal Responsibility. In this maiden edition, I'm going to be looking at the first segment of it, Take Personal Responsibility in Your Health. Take personal responsibility in your health. As a word of definition, I would like us to understand what health is. The World Health Organization, in their definition of health in 1948, defined health as a state of complete physical, mental, and social well-being, not merely the absence of disease or infirmity. Therefore, we need to be healthy in our physical body, in our minds, and in our social interactions. Not merely the absence of disease or infirmity. Oftentimes when we talk about health, a lot of us will think it's when we don't have disease, that's when we're healthy. No. When you don't have a physical disease and you have a social disease or problem with interacting with people, you're not healthy. Or when your mind is not stable, that person is not healthy. So that's how the World Health Organization defines health. And we're going to be looking at it based on factors linked up to these three domains. And you remember in our theology that the human being is a tripartite being. We have a spirit, we have a soul, and we have a body. In my platform, I like to approach my discussions by taking care of the total man, spirit, soul, and body. Now, the choices we made yesterday determine where we are today. Therefore, the choices we make today will determine where we'll be tomorrow. Think about it. That's how important our choice is. What does it mean to take personal responsibility, you may ask? To take personal responsibility means to be in control over your thoughts, over your actions or behaviors, and over the choices you make. You have to be in control over your thoughts, your behavior, and the choices you make. The essence is for us to dwell safe, secure, and healthy in our lives. Remember, if our physical bodies expire, our spirit man or our souls will not have any place of existence and will cease to exist on earth. That's why we need to take care of our bodies. Very, very important. I, as a medical doctor with some trainings in psychology, am very passionate about our physical well-being and our psychological well-being and our spiritual well-being. It is my desire that each person I meet or that God brings into my space will live healthy, as much as it depends on you and I. Okay, now what are the areas we need to take personal responsibility? I'll start with primary biology, elementary science, what we taught there. That's in the area of our personal hygiene. I'm sure you've heard about that. Personal hygiene has to do with a lot of rules and practices we engage in to ensure that we are clean, our bodies are clean, and we keep disease or causing agents, the germs, at bay. We learned it in our elementary school. First of all, we need to keep our teeth clean. Every morning after your meal, you brush your teeth or you rinse your mouth. And the last thing at night, you are supposed to also brush your teeth after your last meal at night. Do not allow food particles to stick to your teeth for longer than that time you ate. Or you rinse your mouth if you cannot brush your teeth. That's what we are taught. Because those particles, when they stick to your teeth, they form culture medium for organisms to work on, and they will end up with dental caries. You wouldn't want that. And I know you wouldn't want to lose any of your dentition. We have been also advised to see the dentist twice in a year. That's the right practice. Now, part of our personal hygiene has to do with good grooming, from our hairs down to our toes. We take care of our skins by taking our bath twice a day or as often as we need it, depending on the kind of job you're involved in. If you sweat a lot, you need to also take a bath and smell fresh and wash off germs from your system. If you want to consider the importance of personal hygiene or good grooming, take a visit to the prison houses, people that are under confinement. You notice their skin has some infections, some fungal infections, some parasitic infections, or children when they return from some boarding houses, they may end up with scabies or fungal infection like pityriasis vesicola. Therefore, it's very, very important for us to groom both our hairs and our skin and our oral cavities very well. That's enough for personal hygiene. Now, let's move on to the next aspect that we need to take personal responsibility in our health, and that's in our eating habit. Our eating habit. What you allow into your system has a lot of roles to play in how healthy you become in the future. We are advised that we should eat adequate diet. An adequate meal or an adequate diet is a meal that has all the classes of food in the right proportion. As a matter of fact, the dietitians say you are what you eat. You are what you eat. How beautiful your skin is, or how fat or slim you are, or how healthy you look, or how healthy your bones are, is a reflection of the nutrition that you give to your body. Remember that whatever we eat, our body, our digestive system, breaks them down into absorbable units called nutrients, and our bodies will absorb them and make use of them, either for fuels for our brain, or for our muscle activity, or even for maintaining our skin, repairs of our body parts. So, the quality of food you eat can also affect your health. I'm sure you've seen people that are under war situation. When there's a war going on in a country, the children are malnourished, the adults are malnourished, and you can see some of them having kwashiorkor, some may have marasmus, some will have all manner of skin infections that take over their bodies because they are not getting adequate diet. This can happen when you may have the food around but you don't take adequate diet. You can be malnourished. Alright, you can be malnourished, but that will not be your portion. So today, take personal responsibility in what you eat. Eat rightly. Then when we eat, we are also expected to eat based on our age. There are certain food an elderly person cannot eat, while a younger person, like a toddler, can eat it. Then, based on the kind of job you do, you also select your meals carefully. Those that are involved in jobs that require exertion of their muscles will need energy-building food that will help them go through that phase without being weak or without being fatigued. Now, for women that are nursing babies, we need to take food that are rich in calcium. For children growing up, the preschool years and the toddlers and even the neonates, they need milk. That's why we feed them on milk. They are newborn babies, they feed on milk. And it helps their skin that get repaired, and it grows and they keep growing better and healthier, and it helps in their brain function. Now, for someone that is involved in academics, you're using a lot of your brain cells are working very hard. You also need to feed very well so that you can have energy to work. Children or young people that are in adolescent or pubertal period also need to eat appropriate diet for that age, so that the losses that they have through menstruation or the growth spots will need food that will replenish those sources of nutrition to the system. Yes, that's for eating. Remember that when you eat, you can either overeat or undereat. Apart from the undereating I've mentioned in malnutrition, you can overeat and it affects your body mass index. Yes, you might need to know what the body mass index is. It's a ratio between our weights in kilogram and our height squared in meter squared. So when you get your weight in kilograms, you measure your height in meter squared, you square the height and use it to divide your weight in kilogram. You get your body mass index. It can give you a reflection whether you're underweight, whether you have an adequate weight, whether you're overweight, whether you're obese or morbidly obese. Remember that when you have excess weight, it can affect your health in the sense that it can give rise, can be a medium for chronic diseases to proliferate in your system. You have things like hypertension, diabetes. You might even have arthritis because you are carrying excess luggage for your joints to bear. Let us keep our weights adequate. So far, we've looked at 3 aspects of our lives that we need to take personal responsibility: our personal hygiene, our eating habit, and our weight control. Now, the 4th area we need to take personal responsibility is our rest and our sleep. They go hand in hand. Rest simply means ceasing from every activity and lying down calmly or sitting calmly with the essence of sleeping or recovering your strength. There are times you might not have a conducive place to sleep in your environment. You could just sit down, close your eyes and meditate. In the process, your energy is revitalized and you're refreshed and ready to face your other activities of the day. That's for rest. While in sleep, you could close your eyes or you just be dozing and you are unconscious of what's going on in your environment. The best quality of sleep is the one that is done naturally, not the one that is induced by sleep medications, sedatives. However, your doctor can place you on sleep medications if you're having issues with your sleeping habits. I'd like us to note something, that there is a tiny gland in our brain known as the pineal gland. It secretes a hormone called melatonin, and it's this melatonin that regulates our sleeping pattern. It's usually highest at night when we are supposed to sleep and rest from the hustles and bustles of life. But however, there are times this rhythm, our circadian rhythm, the rhythm between when to fall asleep or keep awake, is disturbed, especially if you have an increased demand on you. You keep awake. You can deny yourself sleep. Even when we're in university, we're taking some caffeines and cola nuts to keep awake so that we can study harder, study for more hours so that we'll be able to pass our exams. There are times like that when you alter your circadian rhythm. But however, after that phase, you should get back to normal. Your biological clock needs to get back to normal. If this demand increases for too long, you realize that you begin to have issues with your sleep patterns. And besides that, as we get on in age, as we grow older in the elderly, they begin to have issues with sleeping pattern. Conventionally, younger people sleep for longer hours, between 10 to 13 hours and sometimes 16 hours. Now for the older people, like myself, I should have at least 7 to 8 hours of sleep a day to be able to refresh. I hope you're getting blessed by this topic. Now let's move ahead. The 5th area we need to take personal responsibility is in our mental attitude. Positive mental attitude. Yes, you heard that. Our perspectives about life affects our health. We need to be optimistic. It makes a lot of difference between health and ill-health, life and death. A classical example was my experience when I was an intern many years ago. I was serving in a female surgical ward in a teaching hospital where I was doing my internship. And there were 2 patients I had, an older lady about in her 50s and a younger girl that was 18 years. The older lady had a simple fracture. She broke her limb and her skin was still closed, but she had a fracture underneath. Every day I come to see her, she'll be screaming, "I am dead. I'm dead. I'm dying." And she kept on saying that. I will always reprimand her and tell her, "Mama, you're not dying. What you have is a simple fracture and you'll get over it. You'll be healed." She kept on having a negative perspective. Well, beside her, about 3 beds from her, was a young lady, an 18-year-old, that was involved in an auto accident, a road traffic accident, where a reckless driver hit her and sped off without coming to take care of her. She was brought to the teaching hospital and she had a fracture, an open book fracture of her pelvic girdle. The pelvic girdle opened up. I remember that girl very, very well. She would always tell me, "Doctor, do you think I can get married? Doctor, do you think I can have children?" And I assured her, with the help of your orthopedic surgeons and God, you will get married. Another day I came and she said to me, "Doctor, I can imagine my traditional wedding. Doctor, I can imagine myself carrying a pregnancy and having my baby and dancing when I have my baby. I've never seen a patient with so much high spirit. Guess what happened? Several weeks later, one of the days I walked in for a ward round, and they told me we lost the patient over the night. And I said, who? I was thinking it was the young girl that died because her condition was more complicated. Sadly, it was the older lady that had a simple fracture. She died. She lost her life. And I think what made that difference was her perception to her ill health. The 18-year-old that had more complicated case ended up getting well. She was discharged, and I believe by now she may be settled down in her marital home. Our perspective about life matters a whole lot. Let us keep our attitudes positive, our mentality positive. You conquer from within before you conquer without, as around you. We need to keep a positive attitude. Now the next one is our health-seeking behavior. When you have a symptom in your body, what do you do? Do you go to a patent medicine dealer, or you go for self-medication, or you allow someone prescribe, or you share prescription with others? It is unsafe to share prescription with others or to go indulge in self-medication. You should see a doctor. Doctors are trained to decipher your symptoms and treat you appropriately. When you get a diagnosis, your case is half treated. Don't go to the quacks. Don't go on self-medication. You need to see a proper doctor. Seek medical care on time, because there's a time between, there's a thin line between life and death. Take for instance, when somebody has a CVA, a cerebrovascular accident, what we generally know in our Africa, in the human parlance, in layman's parlance, as stroke. The brain is saved over time. If you fail to present earlier, you go from one herbal treatment or the other, or one home or the other, and you keep trying and doing one thing or the other, you may lose that brain. All those function that has been affected will never return. Brain is time. Seek medical help promptly. Now, finally, the area I want us to look into and take personal responsibility is in our preventive practices. We need to indulge in practices that will keep diseases at bay. Part of the preventive practices I've already mentioned in personal hygiene, but the other one is, for a female, you need to do a breast self-examination every month after your menses, by the 5th to the 10th day, 10th day after your menses, when the breasts are no longer tender. You're supposed to do a breast self-examination. How to do it abounds so much on the internet. You divide your breast into 4 imaginary quadrants, and with the pop of your finger, you palpate and check. In summary, we've looked at take personal responsibility in your health. Take personal responsibility in your health. The areas we mentioned that we need to take personal responsibility includes our eating habit, positive mental attitude, exercise, weight control, health-seeking behavior, and of course, in our preventive practices. Remember too that we mentioned something about rest and sleep. Precious sleep, it's not enough to listen to a teaching or process an information. What is most important is what you do with what you have heard. And that's the message behind my video today. We need to take personal responsibility of our health. We need to take personal responsibility for our health. Remember, prevention is cheaper and better than cure. Prevention of a disease is cheaper and better than cure. And in medicine, doctors believe that we care while God gives the healing. Do your own part, your doctor will do his own part, then God will perfect your healing. Health is by choice, not by chance. You need to take purposeful steps, make right choices today for you to enjoy good health in the future. Even if you have a chronic family history of hypertension or any other chronic disease, your choices today will influence the quality of life you will have tomorrow. And for your children you are raising, remind them to live healthy, make right choices for a healthy tomorrow. This brings us to the end of our first segment of our video for the month of April. I will be uploading the second video on take personal responsibility in your spiritual life. Watch out for my next video. Till then, it's goodbye. Stay healthy, stay safe, and take personal responsibility. Goodbye.